And welcome back. You're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. A special welcome to those of you joining us virtually. In our studio is a company that specializes in medical tourism. We have Tom Garner, who is Executive VP of SkyMedicus, and Amy Holcomb, who is the founder and CEO of SkyMedicus. Welcome to you both.
Thank you.
Thank you.
How popular, first over to you, Tom, how popular is it for people to travel outside of the United States to get medical procedures?
It is quite a large industry right now, over $100 billion a year, and we see it growing. We really are focused on trying to be sure folks that come through SkyMedicus can be assured that they're going to providers who represent quality care, that have been credentialed, that we have visited, and we want to be sure that it is somebody that we personally would be comfortable going to ourselves.
What has led to the growth of this industry? Tom, why don't you take that one?
The growth, the barriers to growth?
The growth, you had said that...
Yeah, it's $100 billion. And the difficulty is there's not a central repository to really know what the trend rates are, because it's after the fact reporting. It's really hard to predict what the current trends are, but we see them increasing, and we see them increasing because we're now seeing employers become interested in helping their employees to go abroad for cost savings reasons, as well as value add for the employee. It's a value added benefit for the employee. So we think it's at the minimum, it's going to be an increasing percentage.
And Amy, you founded this company 15 years ago. What were you seeing then that you thought you could address with people going
Well,
overseas?
Mabel, I think that for us, I actually worked for the government for quite a while, and I hurt my back. They told me I needed to have spinal fusion, and I was looking for alternatives. I happened to go to Mexico and find alternatives for myself, and I never had to have that fusion, which I didn't understand how that would help me, right? So I thought, well, how would my parents have done this? How would my neighbors have done this? And I thought there has to be a system, something that we trust, someone that can go check out these facilities, that can help you with the transportation and the passports and getting quotes and all of this kind of stuff and pulling it together and helping me. I mean, I want that best friend traveling with me, right? I want somebody I can call in the middle of the night. I want to make sure I get there and I don't speak the language and somebody can help me. So that's what we've developed.
And you're saying also that what's leading to the growth is the companies themselves, employers seeking this kind of option for their employees?
You know, deductibles are going higher and higher, and everybody's looking to cut costs. It's one thing for you to break your hip and go have your insurance pay $40,000, but when it comes out of your own pocket, you're looking for cash pay. So that's typically where the market was. Now employers are looking at high plans or self-funded insurance, and they think, how can we cut these costs? You know, as we all know, the market is kind of skewed with where those insurance rates are going. And so for them, they could offer something where ordinarily maybe they have a knee that they're paying $30,000 on, and maybe their employee has a $4,000 deductible. Now they can pay $10,000 and send them to a country like Costa Rica, El Salvador, Mexico, Cayman Islands, and not have the employee pay anything. So it's a value-added benefit for their employee who gets this all-inclusive vacation with their family, gets top-quality care from credentialed doctors, a lot of that have trained here in the United States, and they're paying like a third of the cost.
That certainly does sound very attractive. But you also said that there are certain markets where you offer procedures in over 42 countries. One of them is Tijuana. You have spinal practitioners in Tijuana offering treatments. How do we know this is safe? Tom, you want to take that?
We know it's safe because of the number of procedures that they have done and the documentation of outcomes that they have on those procedures. And that's part of what we look at, especially procedures that are not available in the United States that provide a significant improvement in lifestyle for the patient at a minimal cost. The outpatient minimally invasive spinal procedure, it literally is an outpatient procedure. The patient goes in, they walk out the same day. They are back at work in 5 days.
What would be the cost in Tijuana versus what we might have to see here in the United States?
The cost for that is not available in the United States, but the cost is like $14,000. Compare that to a spinal fusion. It's over $70,000. The patient is going to be in pain for at least 2 months, will not be back at work until 2.5 months, and will never have full range of motion, as opposed to the other alternative.
And if I can,
Yes, please.
we also credential the physician. So we not only walk into their facilities, we check, are they filtering water before it's being used on you? Are they doing spore checks on their machines? We take their licenses and verify them with the authorities. I mean, it's not just that we're taking their word for it. We're actually tracking all of that data and credentialing them before you go so that you can feel safe that they are who they say they are. It's not just going across the border and somebody has a dentist sign and going in and not knowing what's going to happen.
Yeah.
Admittedly, that's what the image is that I have in my head, but it's certainly being turned by what you were saying. Amy, what if there are complications when you return to the United States?
Well, there's complications with every surgery, right? There's always a risk, and this is what we tell patients. Any surgery you go to, even a minor one, you could have some type of complication. We have low infection rates and low complication, a lot lower than what's standard in the United States. However, most times if you have a complication, you go back to your general practitioner, and that's what happens in these cases. If you have a wound and it gets infected, you go back to your general practitioner and they take care of the infection. It would be the same situation.
And patients tend to stay. Let's say they've gone for a surgical procedure. They stay a couple of 3 days later. So the physician can look at the surgical site before they leave. And if there are going to be complications, typically those complications are going to manifest themselves within a very few days.
Right, such as a lap band. I mean, it may be outpatient here in the United States, but they may be there for a couple days, just monitoring, making sure that the first food is going through their system and that there's no digestive issues.
Okay, well, Amy Holcomb, Tom Garner, thank you so much for stopping by. Very interesting.
Thank you.
Thank you.
And I'm Mabel Jong. Thank you. Please stay tuned. We have more to come.